I am Dr. Chandrashekar, consultant pediatrician from Narayana Multispeciality Hospital, HSR Layout. I'll be discussing about pediatric obesity or childhood obesity. Now, children who are obese, we all know that a child who is obese will most probably grow into an obese adult. So we should now try to start treating right from the age of childhood. So if somebody is going to get obese, we have to manage it right at that time. Otherwise, he's going to develop into an obese adult. An obese adult has got its own complications. So better know what is childhood obesity. Any child who is more than the 97th centile in the pediatric charts, we have got WHO charts, we have got IAP charts, mark on these charts, and when the child's weight is more than 97th centile, he comes into the bracket of obesity. Or when he has crossed 75th centile, he becomes overweight. Now, any child who is overweight can become obese. Now, this is a common problem in pediatric practice. In abroad, where developed countries, you see one in three children who is obese. And now in cities, in metropolitan cities in India also, including Bangalore where we practice, 1 in 5 or 1 in 8 child is going to be obese. So now, how do we explain the parents and how do we get rid of this problem? First of all, try to mark the weights of all children on the chart and explain the parents that your child stands where. Always parents think that my child is not eating. This is a common complaint usually told to most of the doctors. My child doesn't eat well. But where does your child actually stand? Is he active? Is he eating okay or is he not eating okay? This is a very common problem to be sorted out. Now, when we mark on the chart, if he is more than 75th centile, we should start treating this child. We should start explaining to the parents. Now, what are the problems of this obesity? A child who is obese will become obese adult. And obese adult can develop most of the complications. The complications are numerous, as we all know, starting from the hormonal problems, the orthopedic problems, the cardiovascular problems like hypertension, strokes, diabetes, or insulin resistance, what we call, hormonal problems like polycystic ovarian disease, or the child has got low self-esteem. So these are the very common problems which these children face. And once they start getting obese, it is a vicious cycle and this child gets more obese and more obese. So we have to connect to the parents and start talking about how to reduce the weight. Reducing weight is not that easy though, but it can be explained to the parents. First of all, dietary control is very important. Once the diet is planned for the child, you should always make sure that his activity is at par with his diet. Sometimes his physical activity should be increased. He should be let alone in the outside. He should be playing more than what he's eating. And he can be given normal food because usually these children require nutrients, including micronutrients. So they should be given adequate food. But again, at the same time, the physical activity should be improved. There should be a game, can plan for sports period for these children. And once the activity increases, usually the weight starts reducing. That is one part of it. The other part of it is usually you need not fix a reduction of the weight. If the weight remains static, that is sufficient sometimes because they grow in height and the weight in the chart it comes down gradually. So that is the best way of doing it. So these children should be treated immediately once they are detected to be overweight or above the 75th centile, and should be followed up for a longer period of time because maintaining is more difficult than treating it. Thank you.